So Mike Gow here at the BACD conference 2018, and I'm just grabbing a few minutes with Elaine. I know it's a busy afternoon. You're teaching. What is it you're teaching today?
We're teaching digital smile design and the collaboration with Invisalign and using the iTero scanner and all digital workflow issues that come from that.
Excellent. And it's a hands-on workshop, is that correct?
Yeah, so we're doing hands-on with the DSD app and also hands-on with the iTero scanners, and we've got 10 scanners in the room, which is probably unheard of, so we're really grateful to Align Technology for that.
Absolutely. And what's the biggest advantage that you find kind of that collaboration, I guess, between the two?
Partly being able to motivate the patient, because we can we can really show them the difference it will make to their face if we move the teeth according to the position they should be for them, not for any predetermined ideal, and being able to show them that and include them in the planning, and then also know that the treatment is predictable following on from that.
Excellent. So this workshop obviously gives some of the delegates a kind of experience of that. They can understand a bit about that process, and I take it there's then further training and things they can look at doing.
Yeah, so it gives them a kind of insight into both the digital smile design and designing a smile from a facial perspective, how to motivate the patients, but then also how to talk to Invisalign and Align and utilize all of the knowledge and the R&D that they've got on how to best use aligners to move teeth, whether you're going to need to restore afterwards or not. How do you plan that ideally?
Excellent. And so the further training courses then, is that through digital smile design, is that right?
So some of it is digital smile design, some of it is through Align and iTero and further training on those scanning. So yeah, it can go in both directions.
And what's the best place for somebody that's interested to kind of get that, on either website essentially?
Yeah, so the DSD UK website has the accreditation programs for DSD, and then through your local Align representative, they'll keep you informed with what's going on with iTero scanners.
Excellent. Now, obviously, we met recently just at the Dentistry Scotland Awards.
Yeah.
And congratulations for your award.
Thank you very much. It was a big surprise.
It's nice, and I think having something that's awarded that isn't self-submitted, actually, it means a lot.
Yeah, it does. I mean, it's kind of humbling at the same time, I was totally unaware, and it's that funny mix of really me, but also being incredibly proud, and I think, being recognised in front of your peers is especially powerful.
And you touched on a point very briefly when you were accepting that award about females in dentistry. Now, actually, in our winter issue, we are going to be talking a bit about that. You mentioned when you were accepting the award about, I guess, wanting to encourage more females to get into more active and more engaging roles. Is that fair? Is that kind of the point you were making?
Yeah. So I've been involved in, I guess, standing up in front of dentists since the early days of my involvement helping set up BACD, and then through the various different teaching roles I've kind of found myself in, and I've had brilliant mentors like Linda Greenwell and other females that have led the way before me, but I do feel that we're really misrepresented, especially in terms of education. We're not misrepresented in the profession, but in terms of the number of female dentists that have something to say and are willing to stand up in front of their peers and say it, that's where the encouragement's needed.
Okay. Do you think? I mean, what do you feel? Do you feel there's a reason behind that? Do you think there's a reason why that? I mean, obviously, just through family life and things, I guess females have a bigger role in committing to family life, I guess, and that might be part of it.
Yeah, I think there's all sorts of reasons. Our society, self-imposed reasons. I don't think there's any deliberate. I certainly don't think there's any deliberate. Intention in the profession to not have females. I think it mostly comes from us, and the words I actually used were encouraging female dentists to find their voice. If you haven't found your voice yet, I encourage you to do that, and a lot of that comes down to self-confidence. It comes down to feeling that you have something of worth to say, but from my own experience, I know how many female dentists write to me and send me messages to say thank you for being such an inspiration, which is a very humbling thing, because I don't really understand how I am an inspiration other than I'm I'm saying things. You know, and it's I've always believed in saying, you know, what's real, what I believe in, nothing, you know, nothing more than that. So I think the reasons are complex. I don't think we totally understand the reasons. I think family life is part of it. I've got 3 children, so I've lived through that. I think confidence is a big part of it, and I also think the networking structure is that our male colleagues, especially in education, and again, I don't think deliberately, but I just think there's a tendency for, you know, for people to invite their friends, and if the people around them are men, they'll ask the men, and if there aren't any women there, the women don't get asked. So I think it's complex, but I think it's not right, because I think when the profession is 50% or more, in some places female, and the educators are 100% male, that's not representative.
Absolutely, and I think actually I think my year at Glasgow was the first year there were more females than males in the student population ever.
Yeah.
And I think that's only going to continue.
Yeah, and in other countries in the world, the balance goes even further. But yeah, education, and this is not a UK issue. This is across the world. There are some countries that are better than others, but in most countries, the educators are mostly men, and you know, and the women are 50% or more in the profession, and that's not representative, and it doesn't give you know, female dentists role models and people that you know, that they can emulate in terms of balancing career, family, and everything else.
It's funny, mind you, because it's almost the opposite within, I guess, normal education. You know, primary teachers and secondary teachers is the flip. It's the other way. Yeah,
and it is interesting, and I don't totally understand it or have all the answers. So I think women are perfectly capable of teaching and perfectly capable of public speaking and everything else. It just in our profession, something needs some help.
Absolutely, and again, I think the point is it's not about not also encouraging males to do these things, because that's not the message. It's I guess, as you say, it's just saying this is something, if you're interested in, then go for it, regardless of your gender.
Yeah, and what I actually struggle with sometimes is even talking about the male-female issue, because I actually believe I'm a dentist, the same as you're a dentist, and the same as my colleagues are dentists. I don't identify myself particularly as a female dentist, but I just have noticed that there is this disparity, and so I don't believe in, you know, having particularly female only this and male only that. I think we're all equal intellectually, but just we need to even things up from an education point.
But I mean, it's true, even looking at the editorial board of Dentaltown UK, you know, we were looking at encouraging dentists that were active in social media, active in teaching, and that was tough. And I think you still are our only female board member, and again, that wasn't a choice of us looking at you know, let's only invite males onto the board. It was looking at who is going to be able to put themselves out there, who's interested, and that's quite tough.
Yeah, I mean, that is, I think that's what I mean, is I don't think it's deliberate. It just is. But you know, there should be a way that we can work, you know, with women to put themselves forward, and you know, and have, you know, the confidence to step up, you know, if they want to, you know, and by the same token, not nobody wants to be the token female. You know, you don't want to do it for the sake of doing it, because everyone should be judged on their own merits, not on their gender. But no, it's interesting.
Yeah, absolutely. So no, you're quite right. And I don't know, is it something in the male psyche, just that the males are more their ego is more such that they're happy kind of putting stuff out there, and I don't know.
I think there was a Channel 4 program that said, and I can't remember exactly, but something about, you know, if a male knows half of a subject, that's good enough, and he'll put himself forward. If a woman knows half of a subject, she'll feel inadequate and, you know, and not feel good enough. So I'm sure there is something there that probably goes back historical wise, but I don't think it's an unsolvable issue. I think we just need some strategies for changing things.
Absolutely, and I think it's something I think that the conversation should continue in whatever forum with that. And as I say, we're going to tackle it a little bit in the next edition. And I thank you for talking about it, because as I say, it's not an easy thing to talk about. People watching this will have opinions not necessarily the same as ours, and that's okay as well.
Yeah, I think that's it. I think we should never veer away from having difficult conversations. I think you have to speak your own truth. You have to stand up for what you believe in, and then it's okay for people to disagree and to be able to have an adult discussion about it. So yeah, thank you, Dental Town, for embracing the subject, and it's interesting to gather other opinions on the matter.
Perfect. Well, let's see where the discussion goes from here. So I'll let you get away because you want some coffee before you get back to teaching. Thank you very much.